Hello friends and welcome back to Dr. A Sajid. It's about 11:30 at night and as promised we'll be going over the next guidelines, which would be chronic sinusitis. Luckily they were very small, so I quickly rushed through them and jotted the stuff for this video. We'll be talking about, so we've done most of the teaching in the acute sinusitis portion. Over here we'll be talking about the definition. Let's give it a bit of a different color. So definition, where as very similar to acute sinusitis, it would be nasal blockage or nasal discharge plus either facial pain or headache plus minus loss of smell. So that's the definition, but the important bit is all of the symptoms should be lasting greater than 12 weeks, which differentiates acute versus chronic sinusitis. Next up, examination findings. Like acute sinusitis, it would be the same, where we'd want to check the vitals like the temperature, the heart rate and the blood pressure. Next, we would want to feel or palpate facial tenderness or anterior rhinoscopy to look for any mucosal inflammation. Lastly would be the treatment of chronic sinusitis. It gives out a very general advice where it says if it's allergic, avoid allergic triggers. It says stop smoking, nasal irrigation, and this one was probably the most important one, where we can give intranasal corticosteroids, but the important part about the steroids is how we'd want to give them for 3 months. And I think that's important for clinic, where we'd want to know how long we can give it for. It also talked about how we can do like a plus minus long-term antibiotics kind of thing. So this is the treatment that the NICE guideline suggests for chronic sinusitis. It also suggests an ENT referral, and the reasons for ENT referral are unilateral symptoms, persistent, so that's basically the same as this one, greater than 3 months of treatment, polyps if picked up on examination, recurrent otitis media or pneumonia, and lastly would be unusual bacteria isolated. So that's pretty much chronic sinusitis. It was very simple, and luckily it just took literally 5 to 10 minutes to talk about. The definition is the same as acute sinusitis. It's just the time frame that needs to be looked into. It should be greater than 12 weeks to qualify as chronic sinusitis. Examination findings would be the same as acute sinusitis, with documentation of the vitals, palpation and anterior rhinoscopy. Treatment is pretty basic, stays within management of triggers rather than anything else, and anterior intranasal corticosteroids last for 3 months. If anything doesn't get better in 3 months, that automatically becomes an ENT referral. Unilateral symptoms: polyps, recurrent otitis media or pneumonia, and unusual isolation of bacteria on culture qualifies for an ENT referral as well. If you haven't, don't forget to like, subscribe, and comment on the video below. I'll be looking into a guideline every day, and I'm trying my best to put out a video the same day as well. I might be looking into sessions where we'll be doing a guideline live whilst being on YouTube. I still haven't figured out the logistics around that, but I look forward to seeing you guys for that. Alright then, bye.